Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Mwaka. First, the highlights. Governor Godwin Obaseki gets second shot of Oxford AstraZeneca vaccine, assures residents of second installment for those yet to receive any dose. Abia State health official vowed to fight vaccine hesitancy and fake news surrounding COVID-19 vaccines as it urges observance of non-pharmaceutical interventions. And Philippine President Rodrigo Duterte threatens those refusing COVID-19 vaccines with jail or shots meant for pigs. As COVID-19 outbreaks continue across the world, the need for coronavirus testing remains urgent and vaccines as well. Approximately 2.3 million tests have been conducted in Nigeria, while the World Trade Organization says Africa is working with the EU and other partners to assist in building regional vaccine manufacturing hubs in 4 African countries. According to Dr. Okonjo Iweala, we have now seen that over-centralization of vaccine production capacity is incompatible with equitable access in a crisis situation. Well, here's more on the coronavirus update.
After a steady decline in the number of COVID-19 infections, the Nigeria Center for Disease Control has announced 86 new infections reported from 3 states in the last 24 hours. Lagos State led the chart with 52 cases. Ondo reported 31 cases, while 3 cases were reported in Adamawa State. The latest tally also includes data from Lagos State for the 19th and 20th of June and 0 cases from the FCT, Rivers, Imo, Enugu, Sokoto, Oyo, Ekiti, Nasarawa and Plateau states. The total number of confirmed cases in Nigeria now stands at 167,292. 240 people have also been discharged after testing negative to the virus, including 139 community discharges from Ondo and 100 discharges from Enugu State. This raises the total number of recoveries to 163,797. After more than a week of recording no casualties, 1 death was recorded in the last 24 hours, increasing the fatality toll to 2,118. The latest update by the National Primary Healthcare Development Agency shows that more than 2 million eligible Nigerians have been vaccinated with the first dose of the Oxford AstraZeneca vaccine, while over 900,000 of those vaccinated with the first dose have now received their second dose. In Africa, there are over 5.2 million confirmed cases of COVID-19 and more than 137,000 deaths on the continent. Globally, more than 178 million confirmed cases, while deaths have surpassed over 3.8 million. The appropriate use of face masks are essential to make them as effective as possible. The NCDC is reinforcing the importance of wearing a face mask appropriately in public places to reduce the spread of COVID-19.
And a visit to the Primary Healthcare Development Center in Abia State shows people both old and young trooping in to take their vaccine voluntarily. However, according to the state's epidemiologist and incident manager of COVID-19 Emergency Operations Center, there is still vaccine hesitancy, which she attributes to fake news on social media, among others. She's asking Abians to disregard the conspiracy theories and take the vaccine, taking charge of their health and observing the COVID-19 protocols.
Of late, we've not been recording much cases, but the last case we had was at FMC. But since then, we've not had any. Though the testings are also ongoing. But incidentally, the rate we are recording cases then, the rate has drastically dropped. We should, everybody, as a matter of fact, come out and accept this vaccination. Is safe, is effective, it does not kill anybody. Even so far, the adverse reactions are even minimal. We've not recorded a life-threatening adverse events following the immunization. So COVID-19 vaccination is safe, is effective, and it is free.
The World Health Organization says depression, fear and low investment by governments on mental health care as well as conflict and COVID-19 pandemic can cause mental disorder if not properly managed. Now, the WHO Emergency Manager in Northeast Nigeria, Dr. Richard Lako, represented by Mr. Samuel Tafa, a mental health officer, disclosed this in Damaturu while declaring open a 5-day training on mental health to 70 healthcare personnel in partnership with the Yobe State government.
During the COVID-19 pandemic, concerns about mental health often resulting from stigma, physical distancing, job losses in many of the settings hardest hit by the pandemic have grown. According to the mental health policies in Nigeria, an estimated 25 to 30% of Nigerian population are suffering from mental illness. To ensure that residents are aware, the World Health Organization in Nigeria is partnering with the Yobe State government to train 70 healthcare workers on early detection of mental health cases and its management.
We know that there is high burden of patients requiring mental health care, and majority of them do not receive quality or evidence-based mental health care. So this informed WHO to support the Yobe State government in training 70 healthcare workers so that this gap can be bridged.
The Yobe State government says the training is very crucial for health workers across its primary healthcare centers.
The training of healthcare workers at primary healthcare level for mental health gap is very, very paramount. We felt these healthcare workers can easily identify cases of mental health at their primary health facilities, manage it accordingly, and where the cases are above their scope of capacity, they can now refer.
Training is of so much important to us because they are teaching us a lot of things that we don't know before. They are giving us awareness and teaching us about the mental health gap we have.
This targeted intervention is expected to strengthen mental health services in Yobe State and ensure equity and efficiency, especially in weak healthcare systems.
The Governor of Edo State, Mr. Godwin Obaseki, has again called on eligible members of the public to make the most of the window of COVID-19 vaccination to get their second dose of the Oxford-AstraZeneca vaccine to boost their protection against the virus. Mr. Obaseki, who was speaking after receiving his second dose of the vaccine in his office, he also assured residents that another round of vaccination is due to commence in a few weeks for those who have not yet received at all.
For those still not in fear about the vaccine, you see, I took the first jab for the vaccine about 12 weeks ago, and nothing happened. I mean, I had no reactions. I've now taken the second jab, and I believe there will be no reactions. So I advise those who have not taken their second jabs to come around and make sure they do, so that we can complete both doses for this vaccine. And for those who have not been vaccinated, the next exercise will commence shortly. And I am using this opportunity to call on every Edo person who has not received the COVID-19 vaccination to get ready, so that when the process opens again in the next few weeks, you should come out and make sure that you get vaccinated.
Well, Dr. Andrew Obi is the Incident Manager COVID-19 response in Edo State. He joins us via Zoom. Thank you for joining us on the program. Let's begin. So we've just seen the Governor taking the second dose of his AZ vaccine. What has been the overall reception of the COVID-19 vaccination across the state? All right, we'll try and reconnect with Dr. Andrew Obi quite shortly, but also staying in Benin, Edo State. African experts from various fields believe that it is time for the continent to step up, change the trend of dependence on foreign nations, especially in the area of production of vaccines and medical equipment, to better position our healthcare system. Also, messages from key stakeholders, including former President Olusegun Obasanjo, and, of course, the governor of Edo State, highlighted this point during the launch of the Coalition for Dialogue on Africa's Independent Task Team on the development of vaccine and equitable universal access to vaccination and vaccines in Africa. It held in Edo State.
Leaders from sectors from across Africa present in this hall in Okada, Edo State, have been brought here by the Coalition for Dialogue on Africa, CODA, an instrument of the African Union, to drive the continent towards discussing and taking action on its development. A former special representative of the UN Secretary General for Central Africa represents the CODA Board of Directors Chairman, former President Olusegun Obasanjo, at the event.
Africa's main challenge is not the lack of funds or resources. Our main challenge is the inability to harness available resources to provide customized homegrown solutions needed to address the challenges we see across the continent.
Vaccines and their development is a major subject here.
Africa must take definite and urgent actions to enhance response to epidemics, pandemics, and disease outbreaks. It further tells us that Africa must own and control its public health response to make it applicable to its populations.
African challenges, for some reason, we kept saying they must be met with African solutions, but we keep turning and going back to the same who have failed us anyways.
The governor of Edo State, Mr. Godwin Obaseki, considers CODA's latest initiative timely.
It is heartwarming, therefore, that CODA and the African Union and the African Export-Import Bank, collaborating with the Benedict University, have decided to address this healthcare challenge in Africa in a bid to achieve equitable access to vaccines and vaccinations on the continent. In Edo State, our government is currently implementing a wide-ranging healthcare reform which is geared towards achieving high-quality healthcare and universal health coverage for our people.
The belief here also is that Africans confident in their ability and working in unity would do better in developing their continent. Jessica Olubuse, Channels Television News.
I understand that Dr. Andrew Obi, Incident Manager, COVID-19 Response in Edo State, has since joined us. Thanks for joining us. Let's talk about the vaccination. What is the overall reception of the COVID-19 vaccine in Edo State?
Thank you very much. It's a pleasure being with you this evening. The reception has been good. There's a lot of enthusiasm to take the COVID-19 jab in Edo State. As at yesterday, in relation to those people who have received the first jab, over 39,000 of Edo residents have taken their first shot. And those that have completed the second dose is amounting to almost 15,000 as at yesterday. In fact, precisely 14,622 as at yesterday. The numbers are still coming in. And so about 38% of those persons who had their first jab in the state have been fully immunized in Edo State. And so we see a lot of people who are enthusiastic about taking their vaccination. We are aware that there's hesitancy. There's a lot of energy around. We see, especially at the community level, people now know the importance of getting vaccinated, and each individual at individual community level playing their own part in ensuring that as a state we are safe and we are protected against COVID-19. So it's an improving process, and we hope that this will continue over the next few days and weeks.
All right, Dr. Obi, stay with us. We need to go on a short break. We'll come back. We still have more on what's happening in Edo State, plus more stories from the international scene. Do join us again. Thank you for staying with us. We still have Dr. Andrew Obi, Incident Manager, COVID-19 Response in Edo State. Thank you for your patience. Tell us about the positivity rate of the virus in the state at the moment.
Well, interestingly, our positivity rate has nosedived. As at our last count, it was 0.1% of the total positivity has been below 5% over the past 3 months. Consecutively, in April, we had 0.3% cumulative case positivity rate. In May, it was 0.2%, and now in June, it's presently 0.1%. For the past 2 weeks plus, we have been undulating with no active case, and yes, the active case that we had that came up 2 weeks ago from one of our reference laboratory were fully discharged. So apparently we don't have any active case in the state. And so when you look at test positivity rate, it's an index to what extent the virus is spreading within the state. And that it has been an all-time low level. And it also helps us to know to what extent the pandemic is being well contained in the state. And so any case positivity rate below 5% is a step in the right direction, and that's what we should aim for. And for Edo State, it's presently 0.1%. But that's not to say that the risk is not there. It's a huge milestone, but it also brings up a greater sense of responsibility, because we need to do more in terms of maintain the establishment. So stakeholders, we need to play our own part in ensuring that these gains already achieved are maintained over time. And thank God for the vaccination exercise that is already swimming across the country and in the state. We also encourage.
All right, Dr. Andrew Obi, Incident Manager, COVID-19 Response, Edo State. Thank you for joining us on the program. Now, President Rodrigo Duterte has threatened to jail people who refuse to be vaccinated against the coronavirus as the Philippines battles one of Asia's worst outbreaks, with a cumulative total of more than 1.3 million cases and 23,000 deaths. He says, "You choose vaccine or I will have you jailed." He said this in a televised address Monday following reports of low turnouts at several vaccination sites. Let's take a look at the global update.
Filipino President Rodrigo Duterte threatens that anyone who refuses to get vaccinated will be sent to jail or given shots meant for pigs.
Sabi ko sa inyo, yung silda dyan sa mga
you get vaccinated, or otherwise I will order all the village heads to have a tally of all the people who refuse to get vaccinated. Because if not, I will inject them with ivermectin, which is intended for pigs.
Legally, of course.
His remarks contradict those of his health officials, who have said that while people are urged to receive the COVID-19 vaccine, it was voluntary and has left residents in the country's capital, Manila, upset. In Israel, growing fears of the Delta variant are prompting reluctant parents to get their children vaccinated. This comes as the number of daily cases more than doubled to 125 on Monday. Israel's two largest healthcare providers that cover most of the country's 9 million population say appointments for 12 to 15-year-old vaccinations have doubled and tripled in the last few days. And as the pandemic wanes, some of the first tourists of the season enjoy a trip on the River Seine in Paris after a year and a half of travel bans and restrictions.
We planned it last year, but we had to pause everything because of the pandemic. And once we heard that the country was opening up, we got vaccinated, and here we are. We were one of the first groups to arrive in Europe.
With infection rates falling, France has dropped the mandate requiring people to wear masks outdoors and rescinded its 11 p.m. curfew. And finally, the Russian government says those who are not vaccinated against COVID-19 or do not have immunity would be unable to work in all workplaces and could be discriminated against. In an effort to compel citizens to get vaccinated, authorities are offering those who do the chance to win new cars and flats, while threatening those who don't with loss of earnings and dismissal.
Well, don't forget to adhere to public health and safety measures as we continue to take responsibility. Well, you can take a look at our website. It's channelstv.com. You can find the latest stories there and, of course, a better understanding of the pandemic. You can see that major story there coming from Rwanda. Apparently, appear to be facing another wave of COVID-19. And the President, Paul Kagame, has said that weddings will now be cancelled, traditional or otherwise. Some of the cases there are surging. A lot of governments are taking different measures to ensure that their citizens are protected from the coronavirus. And this is as Africa indeed positions itself to vaccines and vaccination. Well, that's our program this evening. Thank you for watching. I'm Millicent Nwoka. Stay safe.